Miss, I'm one of the doctors in this clinic, Dr. Su. So how may I address you and your baby? Okay, Miss. From the notes, Miss Lily, I've seen that. From the notes, I've seen that your child has been a fever and difficult breathing for 2 days. So let me check first. Let me check his vital signs and we'll get back to you. Is that alright? Dear examiner, since the child has been having a fever and difficult breathing, I would like to check his vital signs, including the temperature, blood pressure, pulse rate, and respiratory rate. Okay. Miss, I've checked his vital signs. He's in a stable condition. She did a very great job by bringing him here. So, in order to find out the diagnosis, let me ask you a few questions. How long has the fever been going on? Did you measure the temperature? Is it high grade or low grade? Is the fever associated with shaking? Did it occur? Is the fever continuous or off and on? Okay. Did you try anything to bring down the fever? Did you notice any particular time or particular thing that might have make it worse, or anything that might have make it better? Okay. You also mentioned that there is a noise, difficult breathing, right? So what do you mean by difficult breathing? How did you notice it? What does he look like? Did he appear to be out of breath, or did he appear to be out of breath, or did he appear to be out of breath, or his breathing seems so fast? So how long has it been going on? Okay, so is the fever and difficult breathing appear for the first time at any previous time as well? Okay, did it occur suddenly or gradually? Okay. Is the difficult breathing occurring continuously, or is it comes and goes? So did you notice anything that might have make it? Did you notice any particular time or particular thing that might have make it better? How about anything that might have make it worse? Okay. Apart from the fever and difficult breathing, also did you notice noisy breathing? So can you describe the noisy breathing sound for me? Can you imitate the sound? Okay. You are a very great man. Thank you. You are a very great man. And that's okay. If you don't know it, that's okay. And how long has it been going on? Did it occur suddenly or gradually? Okay, did it occur continuous or off and on? So what was he doing before the noisy breathing appeared? Did you notice, by any chance, did he accidentally inhale or swallow? Did he eat any small pieces or chunks of food? Okay. Did he turn pale or blue? Okay, so he has a fever, noisy breathing, difficult breathing. And apart from this, did he have any other symptoms like coughing? When did it happen? When did it occur? How long did it last? So when did it occur? How long did it last? Is it continuous or off and on? Did he cough with phlegm? Did he cough with phlegm? Did he cough with phlegm? Okay. Did you note? Did he produce any loud noise at the end of the cough? Okay. Like barking. Did he produce any loud noise like barking cough? Okay. Did he vomit at the end of the cough? Did he produce any sound like whoop at the end of the cough? Okay. Did he have any runny nose, sore throat, rash, nausea, vomiting? Be all. Rash, nausea, vomiting. Chest pain chẳng nhẹ. Any change in voice, difficulty in swallowing, painful swallowing. So okay, difficulty in swallowing, painful swallowing. Now how about his urine bowel motion? Difficulty in swallowing, painful swallowing. Okay, so when did it happen? When did it happen? How long? So when did it happen? Okay, how about his water walk? How about his bowel motion? Can he eat well, sleep well, play well during these days? Okay, did he contact with any sick child at home or at daycare? Did he have any recent traveling? Is his immunization up to date? Okay, Anyone smokes around the child? Anyone smokes around the child? Okay, how did he any recent regular prescribed or over-the-counter medications? Okay, thank you. Physical examination. Then I would like to proceed with the physical examination. I would like to check the general condition. I would like to proceed with the examination. I would like to know the general appearance of the child, whether he is violent, alert, or either toxic. Okay, did he adopt something post-childlike? Did he adopt something post-childlike? Did he adopt something post-childlike? Sitting on his hands, bending forward, hyperextended neck, and tongue sticking out. Any drooling of the saliva? Any noisy breathing like stridor? Any noisy breathing like a stridor? Any signs of respiratory distress like nasal flaring, accessory muscle walking? Then I would like to do the upper respiratory examination. First, I would like to check the inspection. Then I would like to do the process the examination of the proper exposure. First, I would like to check that on inspection. I would like to check whether there is a chest wall movement is equal on both sides. Is there any chest wall deformity? Chest wall movement equal on both sides, or any chest wall deformity, or any accessory muscle walk, or any intercostal or subcostal indrawing. On palpation, I would like to check the trachea is in the midline, or any presence of trachea tag. And then I would like to and then I would like to know the percussion note or arteries on both lymphoids. And then on auscultation, I would like to check apart from the vesicular breath sound, is there any other sound like crepitations and wheezing. And then I would like to check the vocal resonance is equal on all three sounds on both lymphoids. And then I would like to check is there any ER discharge or nasal discharge. Since I'm suspecting the epiglottitis, I would like to skip that throat examination. Then to rule out the congenital end, then I would like to do the brief CVS examination to rule out congenital heart disease. Is the APAS-B displays or not, and is there any other added sound apart from the first and second heart sound? Okay, and I will proceed to the explanation. I will proceed to that, and then I will proceed to the explanation. Miss, according to my assessment so far, your child has a condition called epiglottitis. Let me try and explain it for you. Here is your windpipe. Here is your foot pipe. There is a valve-like structure there is a valve-like structure covering the windpipe, what we call the epiglottis. Epiglottitis is the infection and inflammation of that valve-like structure caused by a bacteria called Haemophilus influenzae. You don't need to remember the name, it's just for the knowledge. Are you allowing me so far? Yes, in your child case, I have seen symptoms like high fever, noisy breathing, difficult breathing, change soft and muffled voice, difficulty in swallowing and drooling of the saliva, and physical examination. He has a typical tribal posture, and on physical examination he has a noisy breathing. He has a noisy breathing stridor and typical tribal posture. All of these facts are pointing toward a condition epiglottitis. I allow me so far. Yeah, this is my working diagnosis, and there are also other possible conditions responsible for a child, like acute laryngotracheal bronchitis, which is the infection and inflammation of the airway and trachea, which is the infection and inflammation of airway and voice valves. Infection and inflammation of the airway and voice valves, and bacteria tracheitis, which is the infection of the airway by a bacteria, and peritonsillar abscess, which is a spreading infection of the tonsil, and it might be due to a foreign body inhalation. So, but I roughly rule out of these in my history and examination, so these are less likely. Okay, are you allowing me so far? Yes, epiglottitis, I don't mean to scare you, but epiglottitis is a serious condition. If left untreated, it can cut off the whole oxygen supply to the body, and so this can be life-threatening. it can cut off the whole oxygen supply to the body, so this can be life-threatening. It can cut off since it can cut off the whole oxygen supply to the body, so this can be life-threatening. So I will refer immediately to the hospital. I will call the ambulance. I will refer him immediately to the hospital. I will call the ambulance, and we are already giving him the oxygen by face mask, and I will while waiting for the ambulance, I will liaise with the pediatric specialist for the first dose of antibiotic. Did you hear any drug allergy? Sounds good. So ceftriaxone 50 mg per kilogram will be given via IV line. So at the hospital, he will be seen by a specialist, and further investigation can be done according to the specialist. And he will be closely monitored. And according to the child's condition, a small breathing tube, what we call that endotracheal tube, can be inserted into the airway to make it open. And if it fails, surgery might be needed. But don't worry, most of the cases recovered with the antibiotic treatment. Okay, I've seen these cases, and most of the cases recover with the antibiotic treatment. And even if it requires, it will all be done by an experienced specialist, so you don't have to worry. Okay, allow me so far. Yeah, since it is a notifiable disease, we need to notify public health authority. Don't worry, your private information is safe with me. It's mainly to prevent the spread of the infection. Is it okay? And for those who are in close contact with the child, we need to have the antibiotic treatment as well. I will prescribe rifampicin for them. And since it is a vaccine preventable disease, you need to do the routine give the vaccination from the schedule.